Well, thank you very much for having me, Amy, and introducing me. I am really excited about this work that we have done at the Department of Public Health and Human Services because it's the first time that we've had data on older adults and disabled adults, as we found out. We've done a lot of oral health data collection on children, especially in the last few years, but we had never done anything in the adult population. And so I'm really excited to share this with you and share with you, more importantly, how we're going to use it moving forward. So that said, I really want to make sure that everyone understands that I want this to kind of be a discussion. I really don't want it just me talking, and so we're going to get to a couple parts where I'm going to ask for a little feedback from you. So if you want to ask a question and you don't want to unmute yourself, please feel free to just type something in the chat box while you're thinking about it and then zip that to Amy, and then we can kind of even look at those after in case you're shy and you don't want to talk. I know during webinars a lot of times I don't feel comfortable asking questions verbally, so I like to use the chat box. So moving on to the next slide. The objectives of this webinar are to understand the health needs, the dental health needs of the nursing home residents, and then really try to make that connection, like why is it important for older adults to have good oral health. And then this is the part where I'm going to have my ask of you of how we can address the needs that have been identified. And I really want to share also that what we've already done with this data that we've collected is that each long-term care and assisted living facility has received a very brief brochure about the findings that basically was the outline of the webinar today. And so we sent that to over 200 facilities. And with my contact information, in case they have questions, I have had people that have reached out to me since that time. And so and then I'm also preparing a data brief, which is currently under review, and I'm hoping gets posted. I was hoping it would be posted by the time we had our webinar today so that I could direct you to it. However, we weren't able to. I'm going to ask that if you haven't muted, to mute. We're getting a little feedback. Thanks. So I have a poll to start out with that Amy's going to set up for us, and basically I just want to understand who's listening to the webinar today. So I'll let her do that for me, and then kind of just understanding where you rate oral health in your practice right now will be the second question. So I'll have you do the first question now, and I think you can only pick one response. So.
It looks like we have one social worker. Yeah, not very many.
So maybe we'll have the others, the two that responded other, go ahead and put in the chat box if they want to. Because we were trying to understand maybe who would want to participate or listen in. So if you want to type that in the chat box for Amy to note for me, that would be great. And then the second question is rating the overall importance of oral health in the work that you do. Right, so we got that one, Amy? Well, great. Lots of importance, so that's very important, so that's good. Great.
And there are some chats coming in as well. It looks like we have someone from the Montana Primary Care Association, and then Missoula Aging Services. An ombudsman.
Oh, great. All right, so I appreciate you guys sharing that with me because it really helps to understand who's listening so that I can tailor it towards what your needs might be. So I am just going to start out with that probably what you already know. This population is increasing, especially in Montana. From the last data that I had, Montana was ranked 6th for the percentage of older adults. You know, we're kind of behind Florida, which you can see that Florida would be a little bit more desirable during the winter months. But this population is just going to continue to increase as we see the baby boomers continue to come into retirement age. And so with that, also increasing is the number of teeth, because as many of you know that are on the call today, dental care has progressed a lot. We have implants, we have restorative materials that we didn't have 40, 50, 60 years ago. And so people are, when they're the working adults that had insurance, because previous generations didn't have insurance, they've leveraged that insurance and they've had some excellent dental work done. And so we're going to see, as more people begin to age and come into long-term care or assisted living facilities, that there's going to be a need for more dental care. There's going to be higher demand because more of them are going to have teeth and more complex restorations that are going to need to be cared for. And so I think that's important to note, because this is just going to be a bigger problem if we don't address it as time goes on. And that's why this study that we did, I think, is so important. So looking back at historical data, of only about a third of the people in 1988 to 1999 had already lost all their teeth by the time they hit 65. And we're really seeing a change in that. We're under 20% of the people have lost their teeth, even in Montana, by that age now. So the retention of teeth is going to be a factor for sure. I'm kind of looking at my notes, making sure I don't forget anything. The other factor that is really important is insurance. When people are of working age, they have insurance, they're leveraging it like I mentioned, but once they hit retirement age, over 70% of retirees do not have any kind of dental insurance. And so that really, we know from research, that really impacts whether they're going to utilize dental care or not because of cost. When we survey people about what are the barriers to dental care, cost is always really high. And so if people don't have dental insurance coverage, it makes a big difference to them on how they're utilizing care. So one of the big things that's come out nationally is this group, Oral Health America. They have been instrumental in kind of really advocating for older adult oral health. And they have some great programs that I'm going to talk about a little bit later. But they started studying the older adult population, and what they did is at a state level. So they wanted to know, how are states looking at this issue? How are they addressing the issue? And in the beginning, in 2003, they looked at, are people using their dental insurance? Do people have access to dental care through Medicaid if they're an older adult? What is the fluoride levels in communities in that state? And they ranked states based on that. And so that year, in 2003, they gave grades. Montana got a D- that year. They did a follow-up study in 2013, and Montana ranked in the under 50 percentile in that study. Our ranking was, our percentage was 45.7%. And then they did another study in 2016 that we ranked out of all the states. They kind of have always changed the way that they're ranking, except for these last couple of years here. So in 2016, they ranked states by how well they did. That year, Montana was ranked 45th in the nation for addressing oral health in older adults. And in 2018, they did a very similar study to the 2016 study, and we ranked 34th. And I think that's important to note, because as they've changed the way that they grade states little by little, it makes a big difference on the activities that the states are doing. Some of the previous studies that Oral Health America did, they really didn't, there were things the state really didn't have control over that they were measuring, and now they've really integrated things that states can do to have an impact on oral health. And some of those are doing studies like we did, the open mouth dental screenings that I'm going to share the findings with you. And then also, how are they planning to address the needs of older adults for dental care as we move forward. And so I'm going to share with you a little bit about what we're doing in the oral health program at DPHHS, so that you know that we're hoping next year, or next time they do their reporting, Montana will be at least in the up and coming of this graphic that you see here. In 2016, we probably would have been down there somewhere by Texas and Oklahoma. So we are an up and coming sort of, but we still need progress. And so I'm looking to all of you to kind of give me input on what direction to go. Ooh, my mouse fell asleep. There we go. So, you know, we're a very diverse state. We have lots of challenges to healthcare, to all social services. And this is a map of Montana dentist providers based on kind of where their concentration is. And you can see that we have some disparities in the numbers of providers. The concentrations along the western portion of the state are obvious, and that's pretty classic with all of the providers that we look at, you know, medical, behavioral health. One unique thing I think about dental is that it's even a little bit more challenging if people don't have dental insurance, because it's such a separate service from everything else. And so that really has an impact. If they are on Medicaid, then there's additional challenges to, if you have one provider in your whole county, are you going to be able to get into that one provider, or are you going to have to travel? Then you get into distance, weather, lots of different stuff. I do have a workforce study that's going to be coming out as well. I'm hoping it's posted within the next month or so. And it really digs a little bit deeper into the dental providers. And I'm anxious to share that with everybody too at some point. So. The other challenge that we have in Montana is a little bit is about the perception of oral health. When we survey people, we know that sometimes oral health isn't always the key thing that they're thinking about. Whoops, I went too many. And maybe because they have other challenges that they're dealing with. So in 2000, the Surgeon General did a report on oral health outlining the importance to overall health. And since that time, the Institute of Medicine has sent out reports. The Health Resources and Services Administration has developed reports basically trying to address oral health issues throughout the lifespan. And with older adults or disabled adults, the impact is even greater because you're often dealing with medications that alter dental health, treatments for chronic disease, the chronic disease itself, and then cognitive changes. So I think working with all of you and being able to identify some areas where we can improve will be really important as we move forward. Well, that's interesting. There we go. I must have hit the button, the magnify button. So oral health relationship to systemic health. There's so many studies on if a person has tooth loss, how it impacts their health and their well-being. And that's done in so many different ways through nutrition. If somebody can't chew, you know, high fiber, protein, that's going to affect the way that their body relates to diet, if they have diabetes or any other chronic health condition. And also, as we age, unfortunately, a lot of times the way that people taste foods changes over time, or medications might even impact that as well. And so sometimes people don't have the appetite they need to be healthy because they have changes in the way that they taste the foods. I've had several patients where that's been a big issue, that they just don't have an appetite because they're finding that things just don't taste good anymore. And then medications can also have a big impact on how much saliva is available in the mouth. So then that impacts chewing, swallowing. So just the nutritional impacts alone are pretty important because of the mouth being the beginning of the digestive tract. So a little bit about our survey. Let's get to the good stuff, right? And you kind of saw a little bit of the preliminary data, but I want you to understand that the survey that we did, it's based on a national set of metrics. We didn't just come up with our own kind of survey. We worked with an epidemiologist, and we pulled the sample from 78 nursing homes throughout the licensed nursing homes throughout the state, and we tried to do that, obviously geographically, so it was representative of the state of Montana. And then we worked with the nursing homes really close because we really wanted to make sure that none of them opted out. We wanted it to be a good experience for them. And so in the messaging, we really shared with them that why we were doing it, and that we weren't trying to survey them. We were just looking at the population. And so the nursing homes that I screened personally, that was a huge message. And when I trained the other screeners, that was the message that I hope got across, because that's how I trained them, is to make sure that the nursing homes understood why we were doing this survey, to create a better delivery system for older adults that were in long-term care settings. So we used verbal consent when we went in. Sometimes in some of the nursing homes it was a challenge to get people to say yes. Sometimes we were scrambling to get the 20 residents that we needed to make sure that we had an adequate sample. So you'll see that one finding that was really interesting is that 14% of the people that were screened were under the age of 65, which really surprised me, that there's that much of these populations. I was not aware of that, and so that was really kind of a light bulb in my head, like, oh, we're not just doing older adults. We're looking at more vulnerable adults, more than we're looking at older adults. And so when we wrote the data brief, we had the intent of doing an older adult survey, but we really changed it to the oral health of nursing facilities, so that reflected truly who we were looking at. So you see about a third of the population was male, and then there was only 10% racial minority, which is pretty common in Montana. We don't have a lot of diversity here, so I feel like it was representative. So the findings. Almost half of the nursing home residents reported that they hadn't been to the dentist in 3 years. And I think that's pretty significant. I was surprised. I went to more of when I did my screenings, I went to more of the urban sites, many of them were. And so this wasn't my experience, but when we pulled all the data together from all the sites, I think this is a pretty interesting metric that I'm hoping that we can address and fix, for lack of a better word. We did survey the nursing facility itself as well when we were in them. And actually, we ended up, because it was interesting to us, we ended up having a staff person call every facility, all 78, and ask them if they had a relationship with a dental provider. So out of the 78, 29 reported that they did have some sort of relationship, and that varied very much. And sometimes they just had a relationship where they sent people out to the dentist, sometimes only for problems. We didn't hear a lot of feedback that people were just going for preventive care, that, if they needed something, then they had a dentist that they sent people to. But 29 of the 78 nursing homes reported that they did have a relationship with the dental provider. 9 of those were with a dentist. 20 of those were with a dental hygienist. So I think that was interesting for us to find out, too, that there's, that much activity. This is actually the metric that I chose for the oral health program. And I didn't choose it. We kind of tried to figure out what is measurable. And so that's why we called all 78 facilities. But we wanted to know, how are we going to measure improving this? And we decided that if we can get more facilities to say that they have a relationship with a dental provider in some way and maybe improve on those relationships, then that could be the way that we impact this. So that's how we're going to move this 47% of residents that say they have been to a dental visit, hopefully. And so that's the metric that is in the Oral Health Strategic Plan that is currently posted on the department website. So, and I think just asking the question of the facility, do you have a relationship with a dental provider? It really helped us understand the long-term care facility's challenges in getting a provider, in identifying oral health needs among their population. And so how do we address those needs is going to be how we're going to move forward, whether that's with training or changing the perception of oral health among older adults, not just kind of thinking, well, that's a natural part of aging, but really trying to get people to pay attention that if somebody has a broken tooth, or that can have impacts throughout the other aspects of what's going on with them, whether that's behavioral or nutrition. So, and then increasing awareness with the primary care providers. So if we have a dental provider that's going in, being able to convey to the primary care provider the needs of that person for dental and helping them try to bridge that gap for dental care. So this is the decay rates that we found in the population. This is stratified by age, and then the blue columns are by minority status. And many of these were not statistically significant between, I think all of them actually, because the minority, obviously there's not enough people, but they're not statistically significant differences, but nevertheless you kind of see the changes in the different age groups. When we survey young children in school settings, the decay rate is right around 25. We've had it, I think the last third grade survey we did 23% of the children had active decay. So I was really surprised that a third of the residents had some sort of decay. So the other thing that was of note is that 28% of the residents had some kind of root fragment where they probably had decay and then their tooth just eventually broke off at the gum line, or perhaps it had a restoration, a crown, and they got decay under the crown, and what happens is basically they just break off at some point with chewing. So that was really interesting too, that almost a third had a root fragment, where their root was there, but they didn't have any of the tooth part on top. So that was pretty interesting finding as well. So the other thing that we really looked at is number of teeth. So we counted teeth in every single screening that we did. And I didn't really explain how we did these screenings. We basically went in with a mirror and a flashlight and a set of glasses if you need them, like me, for reading, and just started talking with the people. We asked them some questions, made sure that they were able to consent to letting us take a look, and then we counted teeth. We also looked at function. So you can have 20 teeth, but if you don't have good function, you're not going to have the chewing ability that you need in order to get good nutrition. And so that was another thing that we really wanted to take a look at. So you can see the tooth loss here, that 60% had less than 20 teeth. That's pretty impactful, but of that, 40% of the people that had dentures didn't have any function. So just what I observed personally is like the resident would have an upper denture but no lower denture, because they didn't want to have people see that they didn't have teeth. They'd wear their upper denture, but they didn't wear a lower denture because it didn't fit well. So we called that, we asked them, do you wear your denture to eat? And if they said no, I don't, then we call that a zero function. So 40% of the people that had dentures had no function. They had no chewing ability with the dentures. And 28% of the people with teeth, with even one tooth, had function on either side of their mouth. So we were looking at function on both sides of the mouth. So if they had function on one side, then we said, yes, they have function. But if they didn't have function on either side, where they were unable to chew on the back teeth on both sides, So almost a third were not able to chew on either side of their mouth in the back to have adequate function for nutrition. So I think that was another big finding that we had. Do we have any questions about that? Because it's kind of a complex. That one I really questioned even putting in here, but I think it's so important for understanding that we can count teeth, but how those teeth come together matter as well. So, and Amy, you can let me know if we get any questions on that.
I am getting a few questions in the chat sent to me privately. So the first one is, how many older adults were screened at the 20 sites? And then how many older adults were screened in total, combination of all sites?
Okay. So of the 20 sites, our goal was to screen at least 20 residents in each site. We ended up screening 452 adults. We did have data missing on a few of those, but I think not every data failed. You know, like one of the screeners may have forgotten to mark something. So we have data, full data on about 450 residents, but we screened a total of 452 residents. And thank you for the question. The other thing that we asked the residents was about tobacco use. So interestingly, we asked them if they ever used tobacco. 44% of the people said yes, at some point in their life, because we said if you've ever in your whole life used tobacco. And it was kind of a fun question as well, because we got to know the, like, oh yes, of course I did. They gave me cigarettes in the military in my, so it was kind of a fun question to kind of lighten the moment and start a conversation with the people as well. So, but the interesting finding in this is that people that have that never used tobacco at all had about 3 more teeth, which I think it's interesting. You guys might think I'm nerdy, but they had 3 more teeth on average. So when we were counting the number of teeth, and you can see current smokers, which we called anybody that had quit within the last year, if they had smoked within that last year, 12 months, but maybe they had quit, 6 months ago or whatever. We called anybody within the last year a current smoker, but you can see they had about 6 less teeth. And so that was another interesting finding, and I'm planning on doing a data brief just on tobacco use as well, to an overall tooth loss in all adults, using a different data set but combining it with this, because it's such an interesting topic to me, because a lot of times people don't connect the two. So that's kind of all of the data bundled up in one brief 30-minute session. And like I said, the data brief will be coming out and posted, and Amy and I talked about this morning because we were hoping that it would be already posted. But we are going to, when we send a link to the webinar, hopefully it'll be done, and we're going to make sure we include the data brief in that link as well in the PowerPoint presentation, so that you'll have access to that as well. So it digs a little bit deeper into the data as well. So, what's the goal of this whole thing? It's to improve on what we found, because we had never collected this data before. We didn't even know what to expect. And just so you know, Montana's pretty even with the rest of the nation with these numbers in comparison. So obviously I would like us to be better than the rest of the nation and move up from 34th in that ranking to be improved. But I think when we're looking at addressing them, there's so many different things. And so this is where I want you guys to feel like you have an opportunity to share maybe your challenges, the barriers that you have, or if you have some ideas. And so I'm going to ask Amy to open it up, and we'll kind of leave it open for a sec. If anybody has any thoughts on the data brief, or if you have thoughts on the unique challenges you see as an ombudsman or through a healthcare system to oral health, I would love to hear that. So does anybody have anything for me?
So what I'll do is I'll unmute everybody. That just gives everyone the capability to mute themselves without me having to do it for them. So if
Okay.
you wish to remain mute, or if you're not talking, I just ask that you go ahead and mute your line so we don't have background noises. So I'll go ahead and unmute, and then also everyone can type into the chat box. Just make sure you're sending your chats to all participants. So everyone's unmuted, and go ahead and mute if you're not currently talking. But go ahead and share your questions, comments.
I know it's always intimidating at these kinds of meetings, but there's only about 10 of us, so I think that should make you feel a little bit more apt to sharing. I just want to understand the challenges that I don't see in my data. So
I have a question. Can you hear me?
yes.
Okay. You mentioned early on about the fact that insurance does not cover dental care very well, and that's why a lot of seniors don't go. Do you and your department have any thoughts on negotiating with insurance companies to improve that coverage? Because I'm a senior and I have to pay extra outside my insurance to get additional dental care. And it's very expensive, especially for low-income seniors.
It is, and thank you for that. That's such an important part, is that dental is a completely different system, right? It has a whole different billing method. It has a whole different insurance system, coding system. And so I think we won't see integration for a while, but there's organizations like Oral Health America that are working on that. One of the things they are trying to do with their work, which is why I love to support their work, is trying to get a dental benefit in Medicare. Not, we have Medicaid coverage for dental in Montana, but they're trying to actually get a dental benefit as part of Medicare for seniors throughout the United States. And so that's why backing their work to me is super important, and why we're having the discussion. So I don't have any good news for you right now, sadly, but it's something we're working towards.
Thank you. That's at least encouraging.
Yes. So just a little bit about what Oral Health America looks at is on policy. You'll see the little water sign there. They look at fluoridation levels. In Montana, we have very little of our communities have at optimal fluoride levels, just in our drinking water systems. So, that's something that's a little bit more challenging to address, obviously, because it's a big undertaking. But they look at that. That's part of Montana's scoring. And then our Medicaid dental benefit, which, hopefully some of the services get reinstated for Medicaid. But that's another thing that they look at, that Montana actually does have in Medicaid a good dental benefit for enrollees, better than most states, let's put it that way. I don't know if I can say excellent, but I think it's better than most states. So
in the chat box, Kathy Peterson typed privately, but I shared it to everyone. I have the same question about Medicare covering dental, as currently Advantage plans don't cover, and neither does Medicare. Also from Kathy, most of my clients are over income or resources to get on Medicaid.
Yeah, I think that's just a recurring thing that Oral Health America has heard as well, is that the cost. When I started practicing, because I am a licensed hygienist, I kept saying, man, these implants are cool. I can hardly wait till the price drops, because if you had to lose a tooth, that is a great option. And I am sad to report 20 years into practice that the price has never dropped. I thought because it was a new technology it would. And just looking at the cost of dental care, nothing, everything has increased. significantly since I started practicing. So I understand that cost is a huge concern. But like I said, that's an important reason to kind of look at this work as an opportunity to bring awareness to the issue. Anything else anybody wants to share? I mean, I think I'm wondering if people have specific challenges in the populations they're serving in accessing dental care for their populations, if there's some unique things out there that I don't understand.
Well, this is Amy. I just know from working with rural communities, many of them don't have dentists, or so they'll have to rely on a traveling dentist, or they'll have to travel to a bigger city. And so we often see with older adults who can't drive anymore, it's very difficult to get those services to them. So I wonder if some of you guys know of ways that people are addressing that, if they're having transportation services come, or if people are doing a traveling dentistry. I mean, I know those are some of the options, but.
Very good points.
Okay, I'm sorry to barge in. I don't want to interrupt.
No, please.
I sent a question to Amy on chat, but I don't know if she got it. But my question is, have you considered going to a few of the senior nutrition programs in the state to ask seniors if they have dental care, and or if they don't, why not? Because they're not all on Medicaid. Many of them are on Medicare, but don't go to the dentist.
Right. So the survey that we did this time, it looked at just the long-term care settings. There have been other states that when they did a survey of older adults, they only went to the nutrition sites. So I think that is something I would love to do in the future. Unfortunately, it often comes down to resources. So, you know, I had some money that I had available that I could do this survey, and so I really this time kept it as simple as possible because it was a pretty minimal budget. But it takes staff time and a lot of resources to complete the surveys. But that is something that is on my radar, and I would love to do in the future. So.
Thank you.
Yeah, I would really like to do that. It would be very interesting. So I'm going to move on to this framework that was developed, and I was trying to remember, because I love this framework, but I can never remember the group that did it, and I'll figure it out and put it on the slide before Amy posts them. But it's kind of a way for us to think about dental care. So just asking about it, maybe looking at the person, you know, do they have missing teeth? Are they a dentulous? Do they not have a denture? And then trying to figure out what to do, you know, how to act based on just your observations. And I think that that just having a framework to do stuff I've found in my work helps keep me on track. So I want to give you some really quick resources, and when we post this, these links are active, so you'll be able to click right through and go to the place that you will see. But Oral Health America, the organization I had been talking about, has a great program that they do. It's called Wisdom Tooth, and it's a program to reach out to seniors in their communities and talk about dental care and what their challenges are. And not just at nutrition sites, but maybe at the senior center when they're doing exercises or something like that. So that's something I'm looking forward to finding resources to do. I've talked to Oral Health America about doing that. And then the American Dental Association always has great resources, and at mouthhealthy.org they have some. The other thing is, if you're a provider or you work at a clinic or a large health organization, this Smiles for Life curriculum is a web-based training, and they have a module that is just on geriatric oral health, or even if you work with nursing homes and you recognize that maybe they need some training in oral health, you can have employees of the nursing facility register, and then they have this module that they completed an hour on oral health, and it helps them understand the specific needs for older adults. And then it could be a training requirement for that facility for their staff. I don't know how every facility is set up for professional development, but it's a great web-based tool, and you can track it. Because then you get a certificate if you register, because you have to take a little assessment at the end, and that could be shared with the director of nursing. The other module that they have in there is the relationship between oral health and systemic health. That's really good as well, and it's an hour-long module as well. So it's a great website to share with people for trainings. Is this smilesforlifeoralhealth.org. So that is all I have. I think we're right on time, but if somebody had a burning question, I'm happy to answer. How does that sound?
I have another question going into me privately. Is there a way for DPHHS to work with partnership to start doing root canals, caps, dentures, since Medicaid doesn't cover those now?
I don't have any resources. My grant that I currently work under is for diversifying the oral health workforce. So I'm looking at integrating, kind of for this presentation, figuring out are there facilities that need training and trying to get CNAs trained, or the ombudsman. We've done trainings with the ombudsman in the past as well. So that's kind of what my job. I don't have resources for direct services, sadly. I wish I did, because once the Medicaid cuts came through, my phone started ringing. People were looking for dentures. They were looking to understand their caps on the Medicaid. So I realize that is such a problem, and it's something the department is working on now that the budget projections are better. But I don't have a good answer, sadly.
Are you still going?
Do we have any other questions at all? Well, I appreciate your time today, and I wish the data brief was done final so I could give you a link to that as well. So I'm hoping within the next couple of weeks that gets posted so you can look at it in a little bit more detail. We probably will be mailing that out to all the facilities as well, just so that they have, especially the ones that participated, so that they know what our findings were. And I can't thank Amy enough for hosting me today. I haven't done a webinar in a long time, as you can tell. I forget the logistics of it all, so thanks for putting up with me.
You did a great job, Tonette. Thank you, everyone, for coming, and I will be sending along this recorded webinar to all your emails if you wish to view it later with presentation slides. And then, as Tonette said, we'll also be linking the data report to that once it's published as well. So thank you all for attending, and please fill out the survey that will pop up once we finish.
Thanks, everybody.